Hello, my name is Michelle, and today I will perform tracheostomy care. The first thing I will do is I will review provider orders and ensure that we are doing the correct patient and the correct procedure. Now that I have reviewed orders, I will gather my supplies and go to my patient's room. Knock, knock. Hello, my name is Michelle. I will be your nurse today. Can I have your first, last, and date of birth? Very good, thank you. So I'm going to go ahead and pull the curtain and perform hand hygiene. And today we're going to be performing tracheostomy care. So I'm going to go ahead and perform hand hygiene and get my sterile supplies ready for use. So I'm going to open this away from me carefully. And I will go ahead and grab my sterile drape and carefully open it. Set it down, and I will grab my sterile gloves and set them off to the side for later. And I will dump the containments of the tracheostomy kit on top of the sterile basin. On top of the sterile drape. Alright, now that I have my sterile basin empty, I will go ahead and do a solution of half hydrogen peroxide, half sterile saline in one of the compartments, and in the others I will just do normal saline. So I did 2 compartments of normal saline and 1 compartment of hydrogen peroxide and normal sterile saline. So now that I have done that, I will go ahead and perform hand hygiene again and apply clean gloves. And my patient is going to be in a high Fowler's position with hyperoxygenation so that they do not get deoxygenated. And you're also going to want to ask them if they're in any pain or if they feel short of breath during the entire procedure. Okay, so my patient is in a high Fowler's position. And I'm going to go ahead and remove the tracheostomy cannula and set it inside of the cleaning solution. Now that I've done that, I will remove the tracheostomy dressing, keeping the tracheostomy in place. You don't ever want it to move or anything. Now that I have gotten everything ready, I'm going to remove my gloves and perform hand hygiene again. Now I'm going to apply my sterile gloves. Okay. Okay, I have my sterile gloves on, and now I will begin the cleaning. So what I'm going to do now is I'm going to grab a couple of Q-tips, and I will put them in the cleaning solution and gently clean around the tracheostomy. And this is going to be my tracheostomy gauze. Grab a dry gauze, soak it in the cleaning solution, and gently clean around it. Now we're going to just soak it in normal saline to get all the hydrogen peroxide off of the patient's skin. And whenever you're cleaning, you want to ensure that they do not have any crust or anything on them, and if you do, you want to make sure you get it all the way off. And now we're going to dry it. And now we're going to go ahead and clean the tracheostomy catheter. So I have the catheter in my hand and I'm scrubbing it. Now I'm going to rinse it in the water. And now I'm going to gently reinsert it back into the tracheostomy. Okay, very good. I'm going to go ahead and discard that. Now that I have done that, I'm going to go ahead and apply the sterile gauze that will protect the tracheostomy and keep it dry. And you're always going to want to ensure that the tracheostomy is in place and it's not moving around, because that can cause danger to the patient and it could actually be dislodged. So just be very careful when you're working around the tracheostomy. So now that I've done that, I will go ahead and remove the ties. And for video purposes, we're gonna just pretend that I have a nursing aide holding the tracheostomy in place for me so that I could correctly do tracheostomy care. Okay, now that I've done that, I will go ahead and apply the ties. And I am doing the one-time method. And you're always ensuring that the tracheostomy is in place. Okay, are you in any pain right now? Very good. Okay, so my CNA is holding it for me in place. Okay, gently bring it over. And carefully tie it and secure it so that you can comfortably snugly fit 2 fingers within the gap, or 1 finger very loosely. Okay, now you're going to tie a knot away from the patient's skin. Now that I've done that, I will grab a gauze and put it underneath the knot so that it does not touch the patient's skin or bother it. Okay, very good. And now we're just gonna tape over the knot. That way the gauze doesn't go anywhere and the knot isn't messed with. So just grab a little piece of tape and just place it over the knot and over the gauze, making sure that it doesn't touch the patient's skin. Now that I've done that, I will go ahead and discard of my supplies. I will remove my gloves. I will perform hand hygiene. I will ensure that my patient is fine and that they don't have any questions, and I will document everything I just did. Thank you very much.